Hi everyone, episode 7 is about how breathing helps control diabetes. A gentle reminder before we begin, this episode is for well being and reflection and not a substitute for medical or psychological treatment. Please reach out to a professional if you're experiencing significant stress or difficulties. Welcome to Dr. VJ Insight, Strength, Peace, and Performance. I'm your host, Dr. VJ Kumar, a psychologist and a coach, exploring ways we can live with strength, peace, and purpose. Today's episode is especially important for millions of people around the world. We're talking about diabetes and the surprising, scientifically supported ways breathing can actually help control it. So let's begin today's reflection. Why breathing matters for diabetes. Most people think diabetes is only about sugar and insulin. Perhaps so, but there is a deeper system running beneath all of it, your nervous system. How does it work? When we experience stress, pressure, busyness, or emotional overwhelm, the sympathetic system switches on. That's the fight or flight responses. This triggers number one, cortisol, two, adrenaline, three, glucose that's released in the bloodstream, and number four, increased insulin resistance as well. And for someone with diabetes or pre-diabetic um, factors, these stress hormones can push blood sugar level even higher. And breathing is the fastest, most accessible way to take control of this system. Other systems that are incorporated with breathing will be quite useful as well. So by slowing down your breath, you switch the body from stress to calm, from sympathetic to parasympathetic, from fight or flight to rest and digest. And this shift has direct effect on blood sugar. The science on how breathing improves blood sugar. Researchers have found three major benefits. Breathing lowers stress hormones that raise the blood sugar. It slows it down. Controlled breathing reduces cortisol and adrenaline. When these levels drop, insulin works better and glucose level naturally fall. Number two, breathing improves insulin sensitivity. Studies show that 10 minutes of slow breathing a day can improve fasting glucose, the autonomic nervous system balance, HbA1c as well. And this is especially important because most people with type 2 diabetes have some degree of autonomic imbalance. And number three, breathing reduces emotional eating and cravings. And when your mind settles, your prefrontal cortex becomes more active. That's the rational part of the brain. This improves decision making and reduces cravings, especially evening sugar cravings, which many people struggle with. So breathing is not just a relaxation tool. It's actually a metabolic tool as well. The best breathing techniques. There are many ways of breathing for diabetes, I suppose, and we've covered some in other episodes as well, if you go back and have a look at those. Coherent breathing, we've talked about it, 6 breaths per minute, inhaling for 5 seconds and exhaling for 5 seconds as well. 5 minutes to 10 minutes is highly recommended. This technique increases the heart rate variability. It reduces cortisol and improves glucose regulation. We've talked about box breathing previously as well. That's the 4-4-4-4 method. So that's inhale with a count of 4, hold the breath with a count of 4, exhale with a count of 4, and hold with a count of 4. And you rinse and repeat. So when do you use this method? Before meals, when craving strikes, before stressful meetings, before sleep. And it has to be a deliberate practice. It doesn't happen often. You got to plan it, and you got to deliberately practice this to have some significant effect. It has to be a continuous, long term. And so what happens? This breath, it steadies the mind and lowers the stress-driven glucose that which normally spikes. The other one that we haven't talked about yet in any of the episodes, yes, is alternate nostril breathing. Mindful pre-meal breathing is helpful as well. So before you have a meal, breath will help, especially if you want to have a pause and get a bit of a control on your eating as well. And what this does is simply relaxes the digestive system, reduces overeating as well, and slows glucose absorption, and improves satiety as well. A small action such as this has got big metabolic benefits as well. So, do you do breathing by itself? It does promote healthy living, and you can bring the other lifestyle strategies with breathing as well. For example, time restricted eating, like intermittent fasting, say 12 to 14. I put the last video on episode 6 was on intermittent fasting. I don't think I mentioned intermittent. I just said fasting, but it's fasting. And I actually do between 12 to 14 hours of fasting. And it's very easily done just overnight. When you sleep, you don't tend to eat. So that covers that as well. And this actually helps keep insulin low during this window period, and helps the body burn fat as well, which is the stored fat, especially the harmful visceral fat. A cup of coffee or herbal tea without sugar is fine during this fasting window. Black tea, black coffee, or things like that doesn't break the fast. And the other thing that research shows that is movements after the meals. A 10-minute walk after eating can reduce post-meal glucose spikes by 20 to 30%. Walking activates the muscles that literally pull glucose out of the bloodstream. And the third one, there's mention over here, is a strength training. Twice a week, perhaps, doing some strength training to build insulin-sensitive muscles. And the other thing that might also help, that goes on hand with breathing, it's high fiber diet as well. High fiber, high protein as a first meal. And protein prevents cravings, and fiber slows down the glucose release. And this combination is the key to stable energy and healthy weight management. Sleep is also important. The quality of sleep matters as well. One night of poor sleep can increase cravings and insulin resistance the next day. And breathing before bedtime makes sleep deeper and improves metabolic health as well. Plan your day well. You could do 10 minutes of breathing while you're doing some stretches, or when you're plodding around the house as well. And it can very easily do 10 minutes of breathing, because when you do some stretches, you can actually incorporate that in that time as well. Some people do Tai Chi as well, and you can, it's pretty much breathing exercises, slow movements with the breath as well. So small actions can actually provide you with incredible impact. So a final reflection: diabetes can feel overwhelming. But what I want you to take from today's episode is You have more control than you realize, not just through medication, but through your breath, through daily choices, small habits that reduce stress, improves energy, and help your body work the way it was designed to. Your breath is always with you, and today it becomes part of your healing. Thank you for joining me for this episode of Strength, Peace, and Performance. Until next time, take a slow breath and live life with intention.